Welcome to Doctor's Desk. Today, we step into the story of a patient whose illness was more than just diarrhea or abdominal pain, a man whose very skin, nails, and strength were slipping away. This is the story of Cronkhite Canada syndrome, a disease so rare that only a few hundred cases exist worldwide. Cronkhite Canada syndrome, or CCS, was first described in 1955 by Leonard Woolsey Cronkhite and Wilma Jean Canada. It is non-inherited and extremely rare, with only a few hundred cases reported worldwide. The hallmark features are gastrointestinal polyps in the stomach, small intestine, and colon, chronic diarrhea and weight loss, often leading to protein loss and malnutrition, and striking ectodermal changes such as skin hyperpigmentation, nail atrophy, and hair loss. The exact cause is still uncertain, but an autoimmune process is strongly suspected. If untreated, the condition can be fatal, and management is often complex. Let me introduce you to a 58-year-old man in China. For years, he lived with alcoholic cirrhosis. He smoked heavily, drank rice wine daily, and once suffered a major gastric bleed. But nothing prepared him for what was coming. 4 months before his hospital visit, it began with diarrhea. Then blood in his stool. A month later, abdominal pain followed. And finally, 2 weeks before admission, something alarming happened. His fingernails and toenails began to fall off. He grew weak. In just 2 weeks, he lost 5 kilograms. On arrival, he was pale, malnourished, and exhausted. His doctors noticed brown pigmentation on his palms, soles, and inside his mouth. His nails? Dystrophic, some completely gone. Already, the pieces were falling into place. Blood tests told a grim story. Hemoglobin, only 6.1 grams per deciliter, which is severe anemia. Albumin, just 2.8 grams per deciliter, marked hypoalbuminemia and protein loss. His body was wasting away. Yet inflammatory markers were normal, and his stool occult blood was positive. Then came the endoscopy. The camera revealed a shocking sight. The stomach and duodenum, crowded with nodular, granular polyps. The colon, carpeted with dense growths, stretching from the ileum to the rectum. Radiography confirmed it, countless filling defects. Biopsies added one more twist. In the stomach, chronic inflammation, edema, glandular hyperplasia. In the colon, tubulovillous adenomas with atypia. These suggest a precancerous condition. Now bringing it all together, multiple GI polyps, nail and skin changes, chronic diarrhea, anemia, and low albumin, and the final diagnosis was Cronkhite Canada syndrome. The patient was concerned about taking corticosteroids. He feared their side effects. So, the medical team respected his wishes and built a different treatment plan. He was given pantoprazole intravenously to suppress gastric acid, hydrotalcite chewable tablets to protect the gastric mucosa, endoscopic removal of polyps in the colon, with titanium clips applied where needed, intravenous albumin and amino acids, along with a high-protein diet to correct his severe malnutrition, careful fluid and electrolyte management, glutamine capsules to heal the intestinal lining, and bifid triple viable capsules, a probiotic to restore healthy gut flora. After 1 month, the results were clear. The diarrhea eased. The pain subsided. His strength began to return. Follow-up endoscopy showed reduced swelling of the stomach and duodenal mucosa, with fewer polyps, although some adenomatous lesions remained. This confirmed the need for long-term surveillance. Now, this case is significant for several reasons. Firstly, it highlights the classic triad of CCS, polyposis, skin changes, and nail loss. It demonstrates how severe anemia and protein loss can dominate the picture. It shows that even without steroids, supportive care, nutrition, and polyp removal can improve outcomes. And importantly, it warns us about the cancer risk, since adenomatous changes in polyps can progress to malignancy. Cronkhite Canada syndrome remains a rare and challenging condition. Early recognition is key. Treatment should be multidisciplinary, nutritional support, endoscopic therapy, and sometimes immunosuppressive medication. This case reminds us to always think broadly. When we see gastrointestinal polyps alongside systemic features like nail loss or skin pigmentation, we should not ignore the possibility of CCS. And that wraps up today's case discussion here at Doctor's Desk. If you found this breakdown helpful, don't forget to like, share, and subscribe for more rare and fascinating case discussions.